We talk about condoms. Condoms are non-hormonal, and then they are also artificial forms of contraception. What they do is to form a barrier so that it prevents the egg from meeting the sperm. You have the male condoms and the female condoms. If they are used very well, the male condoms are able to prevent 98 women out of 100 women from getting pregnant if used consistently for a year. But if it's used in its typical form, it's able to get 13 out of 100 women pregnant. The female condoms, if it's used correctly, 95 women out of 100 women will not get pregnant if used consistently as their form of contraception for a full year. But if it's used in its typical form, 21 women are able to get pregnant. Another beneficial thing about the condom is that it prevents you from getting sexually transmitted infections. We'll talk about the hormonal ones now. There are several forms of the hormonals. The hormones in the woman's body are estrogen and progesterone. These are the hormones that control your fertility. These are the hormones that make you ovulate or doesn't make you ovulate. When you get pregnant, these are the hormones that are involved in carrying the baby to its time. So what these hormonal methods do is to regulate the amount of estrogen and progesterone in your body so as to prevent ovulation. And as we all know, without ovulation, conception cannot occur. You cannot get pregnant if you haven't ovulated. So that's the main action of these hormones. Another thing they do is, because they are regulating the hormones, the cervical mucus that is produced. You remember when we talk about the cervical mucus method, at some point when you are not fertile, the cervical mucus is very thick. So that's what these hormonal ones do. They make your cervical mucus very thick. When it happens like that, the sperm is not able to pass through to get to the egg, even if you ovulate. We have several types of them. We have the combined hormones, we have progestin-only hormones, we have the emergency contraception, we have the injectables, we have the implants. For the first one, we'll talk about the emergency contraception. Let's give a scenario. You're on your way to a place, you are speeding, you are enjoying your ride, you are moving on and on, you are cruising at 120. Then you realize that you have to make an emergency stop. What do? That is where the emergency contraception comes in. In the heat of the moment, you forget to use some form of contraception that you are probably on, or you forget that you are fertile around that period. The couple are so much into their activities that they forget that this is the woman's fertile period, so this woman can get pregnant. How are we going to prevent the woman from getting pregnant at that time? The emergency contraception comes in. It's a form of an IUD. So we have the emergency contraceptive pills. These pills are taken if you had unprotected sex within 5 days. They work only within that time. If it's taken more than 5 days after the unprotected sex, it's not effective. It also works to prevent or delay ovulation. If used correctly, it's able to prevent 99 people from getting pregnant in a year. But if it's not used correctly, then it's able to prevent 98 people from getting pregnant. It's not a contraceptive method that is advised for regular use because the hormones that are in the emergency contraceptives are so high that when you keep on taking them, they will distort your cycle. So that is when you have the abnormal menses, it will distort your cycle. So then when you are ovulating, you're not even sure when you're ovulating or not, and then if you don't take care, you will get pregnant. So once you start to take an emergency contraceptive for more than once in a cycle, then it's advisable that you get a regular form of contraception. It's not advisable to take these emergency contraceptives as your regular contraceptive method because then it will distort your cycle and then cause problems for you later on. Some of the side effects of the emergency contraceptive, because they are hormones, they would alter your hormonal balance. So you would definitely get some side effects. The commonest ones are the bleeding abnormalities. You may have irregular bleeding, you may have lighter bleeding than normal, sometimes you may have infrequent bleeding, then sometimes your menses may not even come, especially if it delays your ovulation. So what you have to do is to bear this in mind, that as you are taking them, there may be some changes in your bleeding cycle or in your menstrual cycle, so expect them as well. Other things it may do is to cause the dizziness, nausea, sometimes breast tenderness. It can also cause weight change, mood changes, and then some of them make the woman more prone to acne. Emergency contraceptives, like I said earlier on, are not advisable as your form of contraception because it may distort your cycle, lead to abnormal menstruation, abnormal ovulation, and then would increase your chances of getting pregnant.